Viewers, welcome to another edition of the Watotijay show. This is your presenter Modulamin Jame, aka the Sultan. With me here is a special guest, and I would like to create him the opportunity to introduce himself. Welcome to the program, sir.
Thank you very much, Mr. Modulamin Jame. My name is Dr. Saikou Bojang, the head of the clinical service, Brikama District Hospital.
Thank you very much, Mr. Bojang, for being around.
Thank you as well.
To receive you.
It's a pleasure.
Mr. Bojang, when did you start your career as a doctor?
I started practicing since 2012 when I completed School of Medicine, University of the Gambia.
School of Medicine, University of Gambia.
Yes.
What did you read there?
I studied medicine.
Medicine.
Yes.
Mr. Bojang, what actually makes someone a remarkable medical personnel?
Yeah, you know, medical field is a professional field, and as a matter of fact, there are code of conduct that a doctor needs to adhere to. Because before you start practicing as a doctor, you normally take an oath that we call Hippocratic oath, which outlines what you should do as a doctor. So any doctor that lived up to that expectation, that goes by that oath, is what is considered as a good clinician, as a good doctor, because all your functions are outlined in the oath. Things that you should do, things that you shouldn't do, between you and your patient, between you and your client, among doctors and other civil sector, your relationship with all those people is enshrined in that oath.
Do you think doctors in the country here are going by that code?
Yeah, I cannot say for certain, but I know many doctors, especially doctors from the University of the Gambia, they are all sworn in, and many of them, the ones that I work with, they are working towards that.
Beautiful.
Yeah.
How do you see the health system in the Gambia?
Yeah, the fact that we are in a new political dispensation, the health system is struggling in the sense that so many things are missing, but notwithstanding, the clinical sector, that is the nurses and the doctors, are trying very hard, though like I said, many things are lacking, but despite all those things missing, the clinical setup is working very hard.
You said struggling yes. In what way?
Like when you look at the health personnel, like any other civil sector, the allowances, the salaries are not good. And as doctor, the equipments are not available. In fact, when you look at the number of Gambian doctors who are specialized up to consultant level, you just count them. And in medical field, the more you are qualified, the more efficient and more effective you become. Do you understand? Like a surgeon, a general surgeon is not considered as a very senior surgeon. You need to specialize in one area, to be a master in one area. So that specialization is still lacking. So many young Gambians are determined to specialize, but opportunities are not created. Now the University of the Gambia is now being recognized as an accredited center for some of these regional colleges like West African College of Physicians, West African College of Surgeons, so that young doctors can do their primaries. But as a nation, if you look at the number of people who specialize to consultant level, are few. And when you look at the equipment also, like a doctor, you cannot efficiently or effectively work when some of the equipments are lacking. Like modern day, investigation, like X-ray, even in Banjul, a big center like Banjul, Edward Francis Small Teaching Hospital, many a time X-ray machine will have a problem. Big centers like Brikama, we don't even have it. Wow. Yeah, we don't even have X-ray. Talk less of echocardiogram, electrocardiogram. If you go to other countries, those ones are readily available even at outpatient department. But as a nation, some of these things are lacking, and modern day medicine requires some of those things. So, but despite all those things missing, we rely on our clinical judgment, meaning we use our stethoscope, our thermometers, and our hands to examine and diagnose patients. So that's why I say, as a nation, our health system, we are struggling. Yeah.
The things that you've mentioned here, do you think those things are enough for you to diagnose someone with a very severe sickness?
Absolutely, they are not even, they are not sufficient. They are not enough. They are not even close to sufficiency. They are not enough. That's the reason why I say we are struggling. Because if you go to Senegal, our neighboring countries, you know, X-ray, you go to even private sector, some of the public facilities, you have 1 or 2 X-ray departments. Banjul being the referral center for the whole country, you know, it will go for months. You know, X-ray machines have problem. Do you understand? CT scan machine, many times, sometimes there will be breakdown, but that one readily is available, but intermittently there are problems. Big centers like Serekunda, they have CT scan, but some of the investigations that I have outlined, they are missing. So the health sector, you cannot have it 100%, but there are certain basic things that you need to have. Do you understand? So that you can make a reliable clinical diagnosis. Because doctors depend on some of those investigations to arrive at a conclusion, to arrive at a diagnosis.
Is the government of the Gambia aware of this?
Yeah, the government of the Gambia, they are aware of it. Like I said, it's a new government. They have their challenges. They have their challenges because I know the authorities in the previous administration, the new the minister that has just been relieved, make an inventory of some of this material, visited all the public health facilities. So some of our shortcomings were expressed to her. See, the authorities have noted all those things that are missing, but you know, it's not a one-day issue. They need to look for funds, look to make arrangements to procure some of those materials. But definitely, it's a new government, but these things need to be available to make the health system complete.
Apart from the things you've mentioned, would you please mind to tell us some of the things that you think are lacking in the health sector of the country?
Yeah, you know, this is a personal opinion. One major thing that I think is lacking, if you go to other departments in the country, like Department of Agriculture, the security, they are doing restructuring and reforming. Do you understand? But in the Ministry of Health, the department as a whole has not been restructured. Do you understand? Okay, it's like the rationale behind you going for a further education to become more efficient. So those with qualifications should occupy senior positions. Okay, if you look at the clinical setup, in everywhere, anywhere in the world, globally, if you look at doctors and nurses, even in the clinical department, nurses work under doctors. Do you understand? Not that doctors are more important than nurses, but that is the hierarchy. So in a situation wherein doctors are working under nurses, it's always a problem. Because the chain of command, there will be some distortion along the line. Do you understand? Like somebody who is more qualified than you, when the person is giving you instruction, you take it and you try to implement it because you know that the authority is coming from a higher body. But in a situation wherein the one who should have occupied the lower level is the one on top, the flow of information becomes a problem. And I've seen that in the public sector, and it's still affecting us in our day-to-day work. In other countries, before you become a doctor, like a nurse, you need to have your first degree. That will take you, BSc in many countries is 4 years. Then from there you prepare for another 5 years
to become a doctor.
To become a doctor. So there is a huge gap. Do you understand? So that information flow, that is what is causing the problem in the health sector. And unless the ministry invite experts and and comprehensively look at the issue, do you understand? There will be unnecessary infight among health personnel. Because if you know that somebody that you senior, do you understand, is giving you directive, it is always very difficult to carry out those duties. It's always difficult. And that is really affecting our service. So our department needs to be restructured. Efficient people, qualified people, like what a Minister of Agriculture did even the time of Jammeh. They restructured the whole department And it has added value to the department. Do you understand? Some people who are there, they are there based on their longevity, like the length of service that they have with the ministry, but they are not qualified. Do you understand? They either need to be redeployed to another area, but the qualified people, the university is graduating, a lot of graduates are coming every year, and the more you graduate from university, coupled with your knowledge, your experience, you become more efficient. So those are the type of people who should occupy certain positions so that the system can work. But that is lacking in the Ministry of Health.
Yeah. And you want to send a message to the government of the Gambia to do something about it?
Yes, I really want to do it. I really want to encourage or persuade the government of the Gambia to comprehensively look at the health sector. The health sector really, it needs to be closely looked at to make it more efficient and more productive. Because productivity and efficiency can only come when the technocrats are occupying certain delegate positions. Do you understand? But if if you put not an efficient somebody, but if you put somebody who is unqualified to man certain key positions, those who are working below him, who are more qualified, will not cooperate with him, and the service will not have value. And health, as we all know, is a very delicate area, it's a very sensitive area, because health is directly dealing with lives. Yeah.
Yeah. Okay, thank you very much for shedding light on that person. You work at Brikama Health Center as a senior staff, you know, the health facility.
Yeah.
I was made to understand that sometimes it's very difficult for people to have proper treatment there, you know, as a result of lack of medicines. Is that really true?
Yeah, you know, Brikama, the problem with Brikama is the largest secondary level public health facility in the whole country. Because Brikama's catchment area, according to, if you go by the 2013 census, people within Brikama and the surrounding is about 604,000 people, which, if you quantify it, it is about one third of the entire nation. Because Brikama is responsible for the entire Combo Central. Brikama District Hospital is responsible for entire Combo Central. It is responsible, it serves as a referral point for all the facilities in Combo South. It also serves as a referral point for all the facilities in Combo East, part of Combo North, and some of the cluster villages along Casamas. They all benefit from Brikama. So the demand is very high. It's very high. So you will see that though the government is providing medications, but not only Brikama, medication generally in the country is not adequate because it is insufficient. We can understand that it's a growing nation, we are in a new political dispensation, but there needs to be an adjustment. Do you understand? The government provides what we call essential drugs. Those are the drugs that are given on daily basis just to save lives. But if the government have money, more drugs should be provided. More personnel need to be provided. More equipment need to be provided to save. But these three things in healthcare, these three things are important. Drugs, personnel, equipment, and structures. Though in the Gambia, if you look at generally, you have a lot of health facilities, public health facilities in the country. Because I think, as far as I could remember, it's only URR that doesn't have a hospital. But all the regions, West Coast region, you know, Biam has a hospital, even though it was wrongly Jungu. The structures are there. But now, even if you have 10-story buildings, but you lack drugs, you lack personnel, the health system, you know, the health system is not complete. So now, I think what the new government needs to do is to consolidate, one, the provision of essential drugs, do you understand? Two, to make sure that highly qualified health personnel are deployed to public health facilities, because the private sector will have quality because they pay. And that is a common phenomenon anywhere in the world, not only in the Gambia. Private have they normally have better service than the government because they pull out money.
Yeah.
Do you understand? And at the end of the day, we are all working to make ends meet. So you will see that health personnel, where you are paid more, you tend to incline to that area. So private sector, they will provide quality. So but the government, like I said, the structures, the drugs, the equipment, the personnel, they are very important. Those four needs to be adequately provided so that the system can be complete. Yeah.
I was also made to understand that there was a time when a lady brought her child to Brikama Health Center, and eventually the child was unfortunate, to be taken by the ambulance as a result of lack of fuel in the ambulance. Is this really true?
Yeah, this incident happened. It happened in Brikama, but if you look at the Gambia health system, the fuel supply and the vehicles, they are not directly under the government. There is an NGO called Riders for Health International. They are the ones that are exclusively for supply of fuel and vehicles and their maintenance. So Riders for Health, they have their own protocols that they operate. They always say the ambulance should not be there without fuel. So the role of the ambulance, it is not within the mandate of the health personnel. They have their regional supervisors and they have their regional unit that is in Kanifing. That's where they are located. So they are the ones that monitors the fuel supply and the ambulances. But as far as I know, for people to buy fuel, Riders for Health, it is against their protocol. The ambulance, when the fuel is about to be finished, you go and refill and you come back. It is 24-hour cycle. So it is, I can say, it is illegal to ask somebody to buy fuel. You understand? Because you have a dashboard. If your fuel level is going down, you should know it as a driver, you go and refill. Do you understand? Though the number of referrals in Brikama, is second to none in the country. Because like I said, Brikama, with the statistics that I gave you, Brikama, the major referral point for Brikama is Banjul. Do you understand? And you and I know that Banjul is about 40 kilometers from Brikama. And on daily basis, sometimes, like during malaria season, an ambulance can have more than 10 referrals. Do you understand? So the fuel can go down at any level, but the ambulances that are provided by Riders for Health, they are always roadworthy. Their dashboard are normal. So if the fuel level is going down, as a driver, you should know, you go and refill. So the idea of telling escorts to buy fuel, I don't think it is in line with the Riders for Health Act, their regulation. It's against their regulation.
There is something wrong somewhere.
Somewhere, yes.
That thing needs to be looked at.
Yeah.
So that a replica of that wouldn't occur
in the future. Yeah.
Like you've said, it is essential.
It's essential.
You want to be very careful.
Yeah, you are right.
Thank you very much for shedding light on that question.
Okay.
Well, I want to know, the common diseases in the country and what can one do to be able to prevent them.
Okay.
This is important for people to know. Can you tell me about it?
Yeah, it's like to make it simpler so that the audience can understand. When we come to diseases in the country, we will just divide them into two. You have what we call non-communicable diseases and communicable diseases. If you divide it in that way, people will understand it. Communicable diseases mean diseases that can be transferred from one person to another, like tuberculosis, like measles, do you understand? Like yellow fever, do you understand? Like whooping cough, Ebola, those are communicable diseases. The non-communicable diseases, these are diseases that cannot be transferred from one person to another. Those are hypertensive diseases, diabetes, asthma, heart problems, heart diseases, congenital heart problems, chronic obstructive airway diseases, pneumonia, you name them. Okay, as far as the Gambia is concerned, globally, for Africa as a region, especially sub-Saharan Africa, at some point, communicable diseases were the problems. Do you understand? Diseases can be transferred from one person to hundreds of people, like tuberculosis. Do you understand? Like, let's say, like let's say measles. You know measles? This pox on the child. Measles is like, yeah, measles is like you will have small spot like these eruptions on the child face. The eyes are reddening, runny nose. Do you understand? The child will have fever. The child will be irritable. Do you understand? In our local language, we call it fusiba. You know, it can, like, you know, in the early days, is what if one child should get that one, the whole community is at risk. The whole household is at risk. So meaning it can easily be transmitted to another person. So these type of disease conditions are called non-communicable disease. They were problems in the sub-Saharan Africa. You know, sub-Saharan Africa, all these negative, you know, effects on health are all attributed to sub-Saharan Africa. Do you understand? Our data is even different from other regions. Everything is on the higher side when it comes to sub-Saharan Africa. But now it is taking, the disease trend is now taking what we call paradigm shift. Now, non-communicable diseases are the ones coming up now. Hypertensive disorders are coming up. Diabetes is coming up. Asthma is coming up. Heart failure is coming up. Heart attack is coming up. Every day, day in, day out, you will just be with somebody chatting. You go home, you know, the only thing that you will hear is the next day the person died. Do you understand? Or you just sit down and see somebody's leg is swollen. Somebody who cannot even walk for a distance, easily be tired. Do you understand? Somebody's blood pressure is, you know, seriously elevated. You know, you just be hearing of Mr. So have, you know, diabetes. So, but in the past, diabetes and hypertension were not a big problem for African countries, especially in the Gambia. But one can also attribute it to lack of machines by then, because it's like blood sugar machines. They are very recent. I know in other countries they have been using blood sugar machines, but I know in this part of the world it is not so long that we started using them. Maybe diabetes and hypertension have been happening, but people were not diagnosing them. So that's why we underreported them. Do you understand? Meaning we underreported, meaning they were happening, but the clinicians were not able to pick them up. Do you understand? To consider them as disease conditions. So if you don't know that Mr. X is having diabetes, you cannot count him as a diabetic patient. Do you understand? But now what we are seeing, honestly speaking, what we are seeing now, we are seeing more of non-communicable diseases coming up. And they are, in fact, you know, and it's very expensive. It's very, very expensive to treat non-communicable disease than communicable disease.
Why?
Because it's like communicable disease, almost all of them, if not all of them, can be prevented. Do you understand? They can be prevented. Tuberculosis, like the commonest one, tuberculosis. When a child is born, within the first 2 weeks, they give BCG vaccine. So if you take your BCG vaccine at the right time, a potent BCG vaccine, you are protected from tuberculosis. Do you understand? Hepatitis, the same thing. Measles, the same thing. Yellow fever, the same thing. Do you understand? But hypertension and diabetes, there are risk factors. Do you understand? If you adjust your way of life, what you eat, you exercise, you reduce your weight, you avoid stress, you know, even if you are hypertensive, your hypertension can be less aggravated, but the hypertension will still be there. But for communicable disease, if you prevent them, you will not have them. Do you understand? And some of the non-communicable diseases, they are familial, meaning they are genetic, they are part of the family. Like you don't have that control over yourself. Like for instance, when your dad is having diabetes, diabetes runs in some families. I've seen families, about 10 of them, they all have diabetes. Do you understand? Now, you don't have the control to prevent yourself from diabetes if it is familiar. Do you understand? But like communicable disease, you can prevent them. So do you understand? But the two, like I said, in the past, communicable disease were a problem for Africa, most of sub-Saharan Africa. But now we have seen a paradigm shift. The non-communicable disease are also, and it's very, very expensive to treat communicable disease. There are tests, you know, for you need to do X-ray, you need to do echocardiogram, you need to routinely check your blood sugar, your blood pressure. You have to be taking drugs because non-communicable disease they are for life. Yeah. Communicable disease they can be treated, they can be cured. Yeah. And you see, the Gambia and many countries in the world, WHO member countries, WHO is doing a lot with partners. If you look at TB, you know, TB is deadly, contagious, you name all the characteristics, do you understand? But the medication is given to you free. The services, everything is free, do you understand? Even to test you is free, do you understand? They will even encourage you, because there is what we call directly observed treatment short course that was initiated and adopted a few years back, do you understand? It's a way of monitoring TB patients up to their home, and they need to take their medication in the presence of a health personnel. Because you see, the TB drugs, there are many, and the duration is up to 6 months, and the size of the drugs is very big. So some people, once they start taking it, they don't have the urge to continue to take the drugs. Along the line, they will not take it, so we call them defaulters. And TB, when you default, reactivation comes in, and when they are reactivated, that's the time that they become more aggravated, more serious. The damages that it will cause in you will be high. Do you understand? But if you look at, like I'm comparing for non-communicable disease, sometimes you don't even need to spend budget to treat yourself. The government is doing a lot on that. There are a lot of projects attached to them. But when it comes to hypertension and diabetes, it's very expensive. It's very expensive to treat those type of conditions. Do you understand? Yeah. Yeah.
Thank you very much. Thank you very much.
Okay.
Mr. Bojang, when you talk about health, it's really broad. Would you please mind to tell me some of its components?
Okay. You know, health as a department is broadly divided into preventive health and curative health. If you understand it in that perspective, life becomes very simple for you. Preventive health, these are the health unit or healthcare workers that are working towards the prevention of health, like public health. Do you understand? Under public health also, you have a lot of units, you have a lot of departments. You have nutrition, you have environment, you have band registration. Do you understand? You have health education. Do you understand? So you have EPI, that is the immunization, expanded program of immunization. You have IDC, that is infectious disease control unit, like TB falls under those areas. Do you understand? So all those units are under prevention, preventive health. Then curative health, that's where you have the doctors and the nurses of different types. You have in the country, you have registered nurses, you have enrolled nurses.
Meaning if anything that escapes the public health officers, directly.
Yeah, you know, it's like,
and the doctors.
As the saying goes, prevention is better than cure. So WHO with partners globally, people are even more worried about preventive health than curative health, because it's like it's easier to prevent. Like for instance, one injection of BCG vaccine will prevent you from having tuberculosis. Do you understand? Okay, fine. You know, that one is less expensive. But how expensive will it be when you become a TB patient? You'll be paying pens, you'll be buying drugs, you'll be going for investigation, you'll be doing everything just to make yourself cured. Do you understand?
That is right.
Prevention is better than cure. Do you understand? You use less effort to prevent, but you use more energy, more resources to cure.
Thank you.
So now WHO with partners, they are trying to prevent diseases. That is why preventive health internationally is more recognized than curative health. Do you understand? You can prevent so many people, like what happened in Ebola. Do you understand? When Ebola struck, do you understand? The whole region was agitated. People had to put their resources together. Do you understand? But at the end of the day, it was contained with preventive method. Do you understand? Those who got Ebola, some of them died.
Yeah.
Do you understand? But it's like they died because they had the disease. To treat it is not easy, but you can prevent it. The countries, all the countries, even countries like Gambia, who are far from where the infection is, we all strengthen our disease surveillance. We all strengthen our emergency response teams were built. Do you understand? To prepare the country, so in case we have an outbreak.
I was going to ask this question. How was Gambia prepared in preventing Ebola?
Yeah, you know, it's like...
this is very essential.
Yes.
Senegal was, you know, actually a victim, even though I think there was only 1 or 2, I don't know, victims, 1 or 2 people that were affected by Ebola in Senegal. And eventually they were able to contain it. This is really essential for us to know, because when you talk about Senegal, you're talking about the Gambia.
Gambia, yes.
Is it?
Yeah.
So that is why I need to know, and I'm sure the audience out there will need to know, how was Gambia prepared in preventing Ebola?
Yeah, the Gambia as a nation, we were very prepared, because that time found me, I think around 2013, 14, something like that. Then I was in pediatric department. Then I was doing my rotation. As healthcare workers, all healthcare workers were trained on emergency response. Personal protective equipments were given. You know, health personnel were trained to prepare, so in case there is an outbreak. And public health officers and other health sectors, they were deployed to ports of entry, like the seaport, the airport, the Silit, Daslam, and all those areas, all those points of entries. There were public health officers that are deployed to screen people. But you know, no matter how prepared you are, preparedness might not be 100% unless it happens. Do you understand? But you know, the country as a nation, the department took it very seriously. Almost all the healthcare workers were trained, and yet the National Emergency Response Team was, you know, was identified. Health personnel were part of it. They were even given an office, the old sanitarium around mile 2. There is a unit. So in case there is a case of Ebola, the victims need to be evacuated. So there were country plans. Yeah, the country was very prepared. So but our preparedness, we are not in that position to gauge it, because we didn't have it. But I know health personnel were trained, and the government took it very seriously. Funds were mobilized, you understand? And even us, as Guinean doctors then, in fact, our referral system, we had some adjustment on the referral system. In fact, patients from, let's say, Brikama, all these facilities in this area, they don't just go direct to the teaching hospital. We screen them at polyclinic first to make sure that no patient with signs and symptoms of Ebola gets to the major referral point. So if the patient happens to be positive around that time, happens to be an Ebola victim, then the plan was to take the patient straight to this place, how to call it, sanatorium. That was the regional, to quarantine the patient. Do you understand? Meaning they don't even want the patient to have contacts with the other patients. Well, you know, Ebola is very, very deadly. And, you know, Ebola, the incubation period is very fast. Meaning it can multiply within hours. Do you understand? And it's very deadly. So the ministry, I think, the ministry tried, the ministry tried very well. They tried very well. Yes, yes.
Thank you very much.
Okay.
Let's take a look at malaria and rainy season.
Okay.
Rainy season has started again, and people out there need to be prepared how to prevent themselves from malaria and everything. So it's important for us to have a discussion about it.
Yeah.
You know, let's tell us about malaria.
Okay. Okay. Malaria, first of all, is an infectious disease caused by what we call a plasmodium, but it's transmitted by a mosquito. So as a matter of fact, it's a mosquito-borne disease. So, but malaria is very endemic in the Gambia, meaning malaria's incident in the Gambia in the past years was going up. But now in the Gambia, with a lot of public health techniques and methods, the malaria incident is going down in the country. So, but malaria season peaks during rainy season. Malaria peaks during rainy season. For the simple fact that during rainy season, the breeding site for the vector, which is mosquito, is very many. Do you understand? Because during rainy season, stagnant waters are very common in our public roads and in our compounds and our households. You know, this stagnant water serves as a reservoir for breeding of mosquitoes. So mosquitoes will breed in numbers, in thousands. Do you understand? So as the malaria season goes on, the number of mosquito, the population expands. Then the transmission of malaria parasite, which is done by the mosquito, is also on the female Anopheles mosquitoes. Not all mosquito, but female Anopheles mosquito. Do you understand? They will transmit the malaria parasite from one person to another. So malaria incident goes up during rainy season. And you know, the rainy season, we have just started. It is gradually, it's progressive. So if you go up to August, that's the time you see many children are vomiting, fever, convulsion, restlessness, pregnant women. Do you understand? And malaria, malaria affects anybody, but it is more serious. It is more severe among children under 5 years and pregnant women, because for the simple fact that children, their immunity is weak. They don't have enough or strong immunity to fight the malaria parasite. Pregnant women, as pregnancy progresses, the immunity also goes down. You understand? So these two groups of people, they are always at risk of malaria. So you see, malaria becomes a challenge. But if you look at the Gambia as a nation, there is a unit called Malaria Control Unit. Like I told you, the health system is broadly divided into two. You have preventive and curative. So malaria control unit is under preventive unit. So that area. So you have a lot of public health officers, although they have some clinicians that are like when it comes to providing malaria therapy, the drugs, you need clinicians to help you to do that. Do you understand? Okay, but principally the public health officers are the ones that are there. Now, in the past, this unit have been doing a lot. They have been doing a lot when it comes to prevention of malaria. Because as you can see, like these mosquito bed nets, insecticide treated nets, they are readily provided by Malaria Control Unit. I think as of 2016 or 15, every household, every pregnant woman in this country is provided with bed net. Every children under 5 years is provided with an insecticide-treated bed, which was a laudable achievement from them. And this has drastically reduced the burden of malaria, the incident of malaria on the population. Malaria incident has dropped. If you make a comparison, a retrospective analysis, like last year before last going, you see that malaria incident goes down gradually, because there are a lot of public health interventions that were done, coupled with environmental sanitation. You know, in the previous government, you know, set is routine, and it was mandatory on every individual to clean the environment. People will clean their environment in groups or individual. Do you understand? Which is a national, it should be a civic duty for every person.
Do you think it's necessary for the government of the Gambia at this point in time to bring back set?
Yes. Set, it's not in fact a matter of option. They need to bring it back. But you know, there is a marked difference between a democratic country and the other government. You understand? You cannot force people to do it. But the authorities that are concerned, the health, environment, the National Environment Unit, and the like, who are part of the package, they should engage the communities. They should discuss with the communities to tell them the importance of environmental sanitation so that people can value it and everybody should take it as a civic duty. Because if the environment is clean, it will not be a breeding site for mosquito. Waterborne diseases like this diarrheal and the other diseases, you will not see them. Do you understand? Because wherein you see flies going everywhere, it's a sign of unhygienic areas. Do you understand? These rodents that you are seeing, like these rats and the other things, wherever you see them, in public health. You know, I did public health before medicine. Okay. I did public health for 4 years. I touched on both sides. I did public health and I did medicine. Do you understand? But in public health, they are telling you these two things. Flies and rodents, anywhere you see them. Rodent means like these rats, squirrel and the others. Do you understand? The ones that are the mouse. Do you understand? Anywhere you see them, it's a sign of poor hygiene. Anywhere. So you see that if the environment is clean, the chances of having some of these disease conditions that we are discussing, like malaria, the incident will go down, meaning the number of cases that will come will go down. And I think the set center really helped. So it is not a force on anybody, but I think the authorities that are concerned, like I said, the health, environment and the like, they need to engage communities. They need to use the media, both electronic and print, to sensitize, educate people on the importance of environmental sanitation. It has to be a routine thing. It has to be done on. The more we do it, the more clean the environment becomes. And when you are clean, you are healthy. Do you understand? So our road conditions are not good. Do you understand? Our road conditions are not good. So you see that during rainy season, when there are stagnant water, like I said, mosquitoes will breed. So do you understand? So if the environment is clean, you have mosquito nets. Do you understand? Some who can afford this indoor residual spraying, these insecticides, do you understand? We will not have malaria. Do you understand? And the impact of malaria on our health is very serious. Do you understand? You see children fitting, convulsions, do you understand? Pregnant women dying, some they will have preterm delivery, some will have abortion. Do you understand? So malaria, the complications are very many and they are very different. Yeah.
Dr. Bojang,
yes.
There was doctor strike across the country. What triggered this?
Yeah, this issue came as a result of a statement made by the former minister, Safilo, who said doctors are the ones responsible for stealing drugs in public health facilities.
Is this true?
No, this thing, there was no element of truth in it. Because as far as I know, if you look at the job description of doctors, doctors don't even have access to drugs. It is not the role of the doctor even to issue a drug to a patient. From the stores, from the airport, up to the pharmacies, doctors are not involved. We don't even know, we know the pharmacies, but where the drugs are even kept, we don't know it. The role of the doctor is diagnose a patient. If the patient needs to be admitted, you admit the patient. If the patient needs to be treated and go home, you write prescription, the escort of the patient, or the patient, if the patient is ambulatory, meaning if the patient can walk to the pharmacy, you give the prescription, the patient goes to the pharmacy and get the drugs. If he cannot get it in public health facility, he goes out and buy it. So, do you understand? So, the statement that the minister said, it was unfortunate. Former minister said, it was unfortunate. Do you understand? It was unfortunate, and it's something that as doctors, that was the least that we expected from her. It was a big surprise to us, because if you look at the conditions that doctors are working in this country, if you cannot praise doctors, you cannot make such a statement. It was very disappointing. It has happened. We cannot do anything. Do you understand? We cannot do anything, but it was not a good statement from our own point of view. Yeah.
Before we come to the conclusion of this discussion, I want us to look at a particular area that is very important, and that is the HIV treatment of former president of Brikama. How do you see this?
If you look at HIV, it's a global problem. So many scientists are struggling every day. I work in the HIV department. You understand? As a medical doctor at Hands-On Care. I'm one of the visiting consultants. You understand? So if somebody else is saying that he can treat HIV, I am not convinced with that. And this has paid dividends. Because along the line, you know, the former president made it because for him, he had been having longer heads with the West to prove those people wrong. But instead, what he expected, that people will just be challenging him, those people didn't challenge, they just left him. Along the line, he left this. Along the line, the treatment was not going on. Do you understand? Because what he expected was, like, if I said I can do this, a lot of experts will come to see whether what I'm saying is right so that I can prove them wrong. Do you understand? But that has not happened. So along the line, he could not continue it. He has to continue with other issues. But I don't think, even conventional medicine, scientists are still struggling much more traditional health.
Meaning his project was a failure?
No, it was a failed one. Completely a failure. It's just a waste of national resources. Yeah.
Interesting.
Yeah.
Let's take a look at this. We have a lot of people that are concentrating on chewing bitter cola. And this is circulating all over with a very essential message that it cures a lot of diseases. Can you tell me you know, what it does in human body?
As far as I know, I don't know any medical importance of bitter cola. But like I said, traditional healers will tell you bitter cola can do this, it can do this, it can do this. But me, I have not seen anything outlined. Maybe unless I Google the internet and see, but I haven't seen it. But one thing that I know, the liver is the largest intra-abdominal organ in the body. And the principal function of the liver is to detoxificate, meaning the toxic materials that you take in, whether to drink or you eat, they are detoxified, meaning they are better metabolized to make it user-friendly for the body. So the more bitter, the bitter materials that you take in, you tend to overload or overwork the liver. Do you understand? Do you understand? So in the process, when the liver is continuously overworked, can lead to derangement in liver, can lead to liver failure. You can have it hepatic failure. You can have liver conditions, different types. But the medical importance of it, honestly, unless I Google, medicine is very broad and it's very diverse. Do you understand? But I haven't seen it anywhere written that it does this or it didn't do this. But
Dr. Bojang, I would want you to send your final message to the public.
Okay. The message that I want to put across is rainy season. We are almost in the rainy season. Malaria incident and other communicable disease. A lot of disease conditions will come if we don't clean our environment. So our basic duty now is let us all clean our environment. Anybody who has signs of malaria, whether pregnant or under 5, whether adult or a child, please do not treat your child or your patient at home. Please take your patient to the nearest public health facility. Do you understand? Health is expensive. Do you understand? The earlier you treat conditions, the better for the patient. So thank you very much.
Thank you very much, viewers, for joining us. Here comes the conclusion of our today's discussion. Well, that was Dr. Bojang. This is your presenter, Modulamin Jame, aka the Sultan. Do not forget to subscribe to our YouTube channel, Watotijay. Click a like on our Facebook page, Watotijay. Thank you.